Hi, everybody. This is Dr. Harry. Today, I wanted to talk to you about pancreatic cancer. It has claimed a few lives this year, the latest being, of course, Mr. Alex Trebek, not to mention Ruth Gator Ginsburg. Now, I want to talk a little bit about pancreatic cancer, maybe answer some questions that you may have, and maybe give you help you to determine what questions you should be asking your physician. So pancreatic cancer happens in the pancreas, of course, and the pancreas is kind of shaped like a pear that's turned on its side and is in the middle of the abdomen here, and it's located in the back, and it's very difficult on examination, for example, impossible for your physician to feel that particular organ when he's examining your abdomen. So this organ has two major functions, and one function, of course, is a digestive function, and the other function is helping your body to handle insulin properly, to handle blood sugar properly with insulin and other hormones. The primary form of cancer that happens, the majority of cancer that happens in the digestive part of the pancreas, and usually tends to happen in the ducts. So why does pancreatic cancer have such a high mortality rate and is so difficult to treat? Well, the answer to that may lie in the fact that most pancreatic cancers are detected at a later stage. And that is because it is very difficult to detect, and there are no really good early screening tools that are available to us right now. So we know we have colonoscopy for screening of colon cancer, which we talked about, and mammograms for screening and early detection of breast cancer. But there isn't a really good tool for screening and detection of pancreatic cancers. So what puts us at greater risk for pancreatic cancer, and how do you know if you're going to have it? Well, there's certain things that we know seems to increase the risk of pancreatic cancers, but most pancreatic cancers really do not seem to have a cause, but these are things that can increase your risk. Smoking doubles your risk of pancreatic cancer than somebody who doesn't smoke. So a smoker has twice the risk of developing pancreatic cancer than a non-smoker. Diabetes seems to increase the risk of that as well. Family history, a strong family history will increase the risk. And there are certain genetic conditions that contribute to that as well. Excessive alcohol use. Excessive alcohol use can cause inflammation in the pancreas and cause a condition called pancreatitis. So repetitive bouts of inflammation in the pancreas can potentially increase your risk of developing pancreatic cancer. Now, there have been some studies in terms of dietary things that have showed that if we eat a lot of sugars and saturated fats and processed foods and red meats with high saturated fats, that it may increase our risk of cancer. So those are some observational studies that have been looked at, and it's not definitive. But I would say, knowing that those foods tend to not be great for general health anyway, it certainly may be worth considering removing those foods from your current diet. So what are some symptoms of pancreatic cancers? The issue with that is that during the early stages of pancreatic cancer, there's oftentimes not that many symptoms. As the cancer progresses, or if it metastasizes to another organ, then you may start developing symptoms. And some symptoms may be abdominal pain. You may feel a pain in the middle of the abdomen, that it goes through to the back, just based on where the pancreas is located, and there tends to be a lot of vasculature and nerves around that area. You may also start developing extremely itchy skin because it starts impacting the liver, and once things start impacting the liver and the bile, many times you start experiencing itchy skin. You may have yellow eyes, your urine may be darker, your stool may be lighter, and that may be all indicative of liver involvement. Because of where the cancer is, pancreatic cancer is located, the pancreas is located, metastases or spreading of that cancer tends to happen more easily and tends to be more aggressive. And so those are some concerns started with pancreatic cancer. So what are some things we have to look forward to, and how then do we perhaps step into a role of being more aware? Well, if you're having any of those symptoms that I talked about, or you have any concerns, or you have a strong family history, you need to chat with your doctor, developing a plan of action. There are some early screening studies right now that are currently being researched and used on people who do have a strong family history of cancers or conditions or genetic conditions that does predispose to increased risk of cancers. For example, having the BRCA2 gene may increase your risk of pancreatic cancer as well. Some of those screening studies may look something like a transesophageal ultrasound. What that means is that a camera is on a long tube that's inserted into the esophagus, and they're better able to visualize the pancreas that way. There are MRIs and CAT scans that are used to look at that area, PET scans to look at that area to see if there's been any changes. And exciting news is that there are some early genetic detection things that may be on the horizon and may actually be being researched right now on people with high risk of developing cancers. And those genetic tests may actually be able to detect early changes in genetic information that may then help us to determine if it looks like cancer is developing in that area. None of those studies are really approved now for the general population because they're currently still being evaluated. But the good news is they are currently still being evaluated, and researchers are really motivated to try to get a better handle on this cancer. I will not go into treatment as I am not an oncologist, but treatments can involve radiation, chemotherapy, a combination of both, sometimes surgery, and that's all discussions that you would have with your doctor and your oncologist. So hopefully this has offered you some information about pancreatic cancers. Maybe it's answered some of your questions. Maybe it's given you questions that you want to discuss further with your physician. Until next time, this is Dr. Harry. Bye-bye.